It is indeed a pleasure to send greetings to the Nightingale community, our nursing community, as we join them, as we join our nurses in celebrating International Nurses Day 2018. The theme for this year, Nurses, a Voice to Lead. Health is a human right. And perhaps it's a good way to look at that theme from an individual and then a collective view or perspective. You know, as we look, nurses, a voice to lead, we speak to leadership and individual leadership so that we encourage our nurses to develop that leadership competency. You know, they are true leaders in the system. They are the ones who intervene. They are by far the strongest, and you guys are by far the strongest and biggest number that we have in our healthcare services. Leadership, we see, is about envisioning so that what is your vision for nursing, you need to know. And the region speaks to things like caring is the key and so on. So that our vision really is to give to our patients a caring and helpful service. So that from an individual standpoint, what am I doing to achieve that vision? And then from the nursing community standpoint, how can the nursing community come together to self-regulate, to be there for each other, to become a community of practice where professional development, caring, and all of those things, those attributes become, propelled to the forefront. The other aspect is health is a human right. And we frequently associate the right to health with meaning access to hospitals or access to facilities and so on. This might be necessary, but I believe that health goes beyond that. I believe that if we look at the determinants for health, the social determinants, it means that we must look at not just, not being ill, but it means that we must look at being well. In other words, our economic well-being, our educational well-being, nutritional, environmental, all of those things are part of wellness. So that we need, as a health team, to move away from the issues of just how many beds and how many hospitals and access to these facilities to the broader perspective, in other words, wellness. Sometimes when we're dealing with illness, we are so preoccupied with adding years to life, so that by getting someone better, we add years to their life. When we focus on wellness, we focus on now adding life to years, in other words, quality of life. And that's what our nursing team can do. And as we focus on quality of life, it's important, and we go back to the concept of individual and community. As an individual, as a nurse, you need to ensure that self-care is important. You've got to take care of yourself, self-care, family care. All of those things are important to ensure that you are able to give of yourself and to give, that caring is the key. You've got to be able to look after self. And then too, there's the community of practice. And what's the professional vision for nursing that you guys as a team would have? How do we strengthen nursing advocacy to bring nursing to a point where you can impact national policies on wellness, national policies on nutrition, national policies on education, all of those things. So you're a force, and you need to become greater and more powerful advocates, advocating within the national community for those wellness factors, those things that bring wellness to our people. Having said all these things though, I just want to say for nursing and for International Nurses Day 2018, I want to wish all our lovely nurses, and that means the males also, not just our ladies nurses, but all our nurses. You are lovely people. You are people who give of yourselves for the benefit of others. That's a noble profession. That's a calling. And I want to say on behalf of the region, thank you to all our nurses for all you continue to do, for how you continue to unselfishly give of yourselves for others. I just want to thank you all for that. I want to thank you all for just consistently being there and offering of yourselves. I hope you have a very enriching and rewarding International Nurses Day, and I hope that we will continue to develop and move towards our vision in the ERHA for creating value, for helping others, for becoming that internationally well-known community of practice that puts our client first and that collaborates at all levels.